Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about hypertensive ulcers. By definition, hypertensive ulcers are extremely painful ulcers that occur in patients that have poorly controlled hypertension. Hypertension is when your blood pressure is more than 140 out of 90 millimeters of mercury. When you have hypertension, your arterioles, the small blood vessels that supply blood from your heart to the extremities, especially the legs and the feet, they tend to undergo some changes. For example, they lose the ability to expand and become flexible and elastic. The walls become thickened and firm. And also the lumen becomes narrowed and sometimes obstructed. And these changes result into a reduction in the amount of blood and oxygen that goes to these areas, the extremities, the feet and the legs. This results into death of the cells and tissues in those areas, subsequent erosion and formation of an ulcer, resulting into hypertensive ulcer. The inherent nature of the hypertensive ulcer is that it is an extremely painful ulcer. Actually, the size and the intensity or the amount of pain emanating from the ulcer are disproportionate. For example, you're going to have a lot of pain emanating from a very small ulcer. Actually, when that happens, it is so telling that we might be dealing with a hypertensive ulcer. The floor of the ulcer has dead tissues. For example, they are going to look black and darkish. Actually, the outline will also be irregular, and majority of the time the ulcer is deep, exposing the deeper tissues, for example, the tendons and the muscles. It is usually common in females between 50 and 70 years of age. It can affect both legs, especially the inner area of the distal 1/3 of the leg. Majority of the time, these ulcers take long to heal. They are very poor at responding to treatment. The patients usually don't have any underlying causes. For example, they don't have any peripheral arterial disorders, they don't have venous problems, and they don't have any kidney problems. The diagnosis is essentially clinical, and it is done after excluding other causes. For example, we exclude kidney causes, kidney problems, peripheral arterial disorders, and also venous problems, venous disorders. It is usually a woman, though even men can be affected, but commonly it is women, usually in their 50 to 70 years of age, having bilateral ulcers or ulcers affecting both legs, especially on the inner side, but they don't have any underlying causes majority of the time. When it comes to the investigations, we do investigations to rule out the possibility of other causes. For example, we do X-ray to rule out osteomyelitis, that is bone infection. We do Doppler to rule out a possibility of obstruction of the bigger blood vessels. We do ECG and echo to make sure that we don't have any heart problems. We do blood sugar levels, lipid profile. We also do a discharge study. If we have any discharge, we do culture sensitivity and also other investigations. For example, ZN for TB. We also do cytology on the discharge. We also do a biopsy to make sure that we don't have any cancers going on. When it comes to treatment, we do a combination of treatment modalities. For example, we do medical and surgical, a combination. We do medical by employing antihypertensive drugs, for example, calcium channel blockers, angiotensin receptor blockers, to make sure that we cause a widening of the blood vessels. Calcium channel blockers include nifedipine. Angiotensin receptor blockers include captopril. We also give you analgesia because there is a lot of pain. We give you painkillers. We also give you antibiotics. We also do surgical management where we debride, we remove all the dead tissues away from the ulcer. And after that, we do daily dressing. And after daily dressing, when the wound has healed, after some time, we do either skin grafting or skin flaps. There is also another modality that we call lumbar sympathectomy. It also helps to widen the blood vessels and also reduce pain in these areas where the ulcer is. When it comes to the prevention, please make sure that you avoid trauma to these areas, because remember, the ulcer can be spontaneous, but sometimes it can come after trauma. Please avoid smoking, avoid using compression stockings, and also the most important part is please avoid being a candidate of hypertension. Make sure that you keep a health diet, you eat a health diet, a diet containing proteins, fiber, potassium containing foods, fresh vegetables and fruits. Avoid a lot of salt, don't eat a lot of salt. Avoid high fat diets. Make sure that you maintain a health weight by exercising. By the way, we recommend that as an adult, you exercise at least 2.5 hours a week. And for children and adolescents, we recommend 1 hour a day. Please make sure that you have a good rest. We recommend sleeping hours should be between 7 to 9 hours. At least that is an adequate sleep for you. It is very good that you have a very good rest. Avoid stress. Please find a way of managing your mental health, because stress is one of the causes of hypertension. Please exercise your bodies, like I've told you. Avoid alcohol, avoid smoking. Yeah, so that is what I had for you. Thank you so much for listening to me. Thank you so much for those of you that have shared my videos. Please continue sharing my videos, continue liking my videos, continue subscribing. Please also click on the notification bell such that you can get notified when I upload a video. Thank you so much. I'll see you in the next video. Bye.